Today we are going to discuss a very important topic, that is breast cancer.
Patients coming with some kind of discharge, that could be watery discharge, or sometimes it could be a blood stained discharge coming from the nipple.
Lumps, basically it comes on the nipple area or any part of the...
The lump is outer side of the breast. That means
How a lady self-examine?
first 5 to 7 days is the ideal time for a breast self-examination. Is there any change in one breast or the other one? What is the level the nipple is?
Which is breast cancer is more common?
Like in clockwise or an anti-clockwise, whichever.
Ladies who are not getting married, in that condition they...
During the pregnancy, these women are very much protected from breast cancer. If they feed the baby for about 1.5 years,
What happens during the mammogram?
it compresses the breast tissue
Okay.
and then it makes an X-ray. So
Namaste, welcome you all to our new episode of Healthy Rose of India. Today we are going to discuss a very important topic, that is breast cancer. Nowadays breast cancer is increasing day by day in India, in the world also. So today we are going to discuss about general awareness, symptoms and diagnosis, what is its treatments, managements, what are the lifestyle and prevention things we have to do. So for a lady, what is the emotional and psychological support, and what is hormonal issues, age, so many things we are going to discuss in the particular podcast. So to know more about this podcast and this topic, please see the video up to the end so that you will get a proper information of the breast cancer. Breast cancer can be avoided, but for that we should know how to avoid and what are the precaution stages and how to avoid all this with the proper information, proper guidance. Please see the video to the last. To know more about breast cancers, today we have invited our guest Dr. B. Ravi Sankar. Dr. B. Ravi Sankar is an oncologist having more than 27 years experience in the field of oncology. So let's dive into the topic breast cancer and know more about breast cancer. Welcome sir, welcome to Healthy Rose of India. This is a podcast where we invite doctors and we do a question and answer section about different topics like you are an oncologist. So today our topic is breast cancer. So depending on the questions and what are the basic questions, it comes to the people's mind, or what are the questions basically the patient think. So we'll discuss about this later on. Thank you for coming to our podcast and joining us.
thank you for inviting me. I really enjoy this because this piece of information really disseminates among the public, so they know more about breast cancer as well. The fear about the cancer also
Yes.
should go.
Yes.
And really, thank you very much for inviting me for this podcast.
Sir, nowadays what we see that breast cancer patients are increased. So is it true right now they have increased, or it was there but it was not noticed?
No, definitely there has been a drastic change. We call it as a shift. So perhaps 20, 30 years ago, the cervical cancer used to be the common cause for cancer among the women.
Okay.
And today, I think breast cancer stands out as a common cancer among the women. Whether it's a rural or urban area, almost most of the places, it is almost same. So we calculate something like on an average in a metros, the incidence of breast cancer is pretty high, maybe close to 32 women gets affected among 1 lakh population. Whereas in a small place like tier 2 cities like
Yes.
Visakhapatnam, I think probably it will be something like 24 to 26 women gets affected among 1 lakh. So on an average, if you see in a place like Visakhapatnam, I think you should be able to see at least 1,000 new cases arising in 1 year period.
Okay.
So we call this as an incidence.
Mhm.
Incidence of, that means a new breast cancer has been diagnosed
in
this particular region.
Okay.
So
Basically, when the patient comes to you, before coming to you, what are the most common signs the breast cancer people basically finds?
So the most common presentation, I would say, among the women is a lump. So when they find it while taking bath or while they dress it up, sometimes they notice that there is something hard which is not normal.
Okay.
So that is most common. And there could be some of these patients coming with some kind of a discharge. That could be watery discharge, or sometimes it could be a blood stained discharge coming from the nipple. And these are the two common things. Apart from that, I think some of these patients also will have a change in the contour of the breast, in the size,
Yes,
and the color of the breast skin.
Yes.
So these are the other signs I think we should always consider and notice for all these changes. If they find anything abnormal, probably they should immediately report to the doctor and say that this is what I am feeling. So should I go for any special test or anything like that?
So, you talk about just now. You told about the lumps. Lumps basically it comes on the nipple area or any part of the breast.
See, the most commonest area to have a lump is outer side of the breast. That means outer.
Okay.
We call it as an outer quadrant. So if you divide this breast into 4 quadrants,
Okay.
outer quadrant is the most common. That's where you have the highest gland area. So the glandular tissue is maximum in that area. That's the reason we find, because see, most of these breast cancers are lumps. They arise when there is a more population of the cells in the duct.
Okay.
So,
sir, if it is a rural area, if it is an urban area, people go to the hospitals and they have a lot of amenities. They can go and they can check whether they have breast cancer or not. But if it is a rural area, so on that case, how a lady self-examined? What any criteria?
That's a wonderful question. I think most often when we see these patients, these rural area patients, they usually come through either ASHA workers or the ANMs. They're working in that area, and most of them, I believe that they give some information about the lump and everything. But when it comes to the self-examination of the breast, it is like patient herself examining her own breast. Usually, it should be done just immediately after they complete the cycle. That means
Okay.
that 3 to 4 days or 5 days of menstrual cycle. Once it stops, from there, I think first 5 to 7 days is the ideal time for a breast self-examination. Point number 1. And point number 2 is it should not be done very frequently. So not to try something, some treasure or something. You should not hunt for something. So it should be maybe once in 3 months or 4 months they can do, or 2-3 months, once in 2-3 months they can do. And they should use these 4 fingers.
Okay.
When they want to palpate this breast, they should use right hand for the left breast and the left hand for the right breast.
Yes.
So it's a simple thing. It's a technique. You just do it like in clockwise or an anti-clockwise, whichever is in it anyway. You can do. Then
outer upper part of the breast.
The entire breast has to be done.
Okay.
The entire breast has to be felt in a circular fashion for about at least 4 to 5 times, and just see whether anything can be felt. Like it could be a peanut size or a little bigger one or whatever. Once they finish this, and they can also lay down and put a pillow under this, and they can examine everything. And they can also stand before the mirror and they can see is there any change in one breast or the other one, what is the level the nipple is, and so these are the observations they can make in front of the mirror. They can do this palpation. So these are the things they can do. And I personally suggest younger women listening to these kind of podcast or some kind of an educatory module they just do on their own, and they get apprehensive.
Yes.
But I think we shouldn't get apprehensive about all these things. But only thing is, it should be done regularly and very systematically.
Better to consult the doctor.
Yeah,
if-
once
if
they
notice
find
it.
anything, they
Yes.
should consult the doctor.
Yes, yes.
Mm.
Sir, all the genders, different kind of ladies, 20, 30, 40, 50. At which age breast cancer is more common?
Okay, if you look at by and large, it is like the most common age group would be something like 40 to 60.
40 to 60.
Yeah, from 40 years to 60 years
Mhm.
and above. And but the problem is these days we are seeing patients at an early age. Those are not married, young women
Okay.
for 20, 25 years, which is a big surprise to all of us.
Yes.
So I think the days have changed. So we have to see, and we can't strictly recommend that these kind of screening programs should be done for only women above 40 years. So we have to consider many things before so take a call. I think probably what should be informed to the patient is if there is a family history
Yes.
in the, say somebody in the family is been affected by the breast cancer, I think the screening has to be started a bit early. Say if the youngest patient in the family is 40 years, I recommend at least from 35 years they should get screened themselves by means of an ultrasound or a mammogram or whatever.
Okay.
And then they can pick it up if there is any problem. But in general, it is like 40 to 60 years. That is the age group commonly we see.
Sir, what are the main causes of breast cancer?
See, the main culprit is like you can make it as modifiable and non-modifiable risk factors.
Okay.
So there is no cause for this. Like you say, lung cancer, you have tobacco exposure. So here it is like the main culprit is the hormone.
Hormone.
So the hormone is, some people they have a high secretion of the hormones and they influence on the breast tissue. So they try to multiply, and then once they try to multiply, during the process of multiplication, there will be some kind of an alteration that's called a mutation. Once there is a mutation, it becomes a cancer. This is how the phenomena is. So the altered hormonal imbalance is basically by our diet,
Yes.
poor exercise, obesity, smoking, alcohol, all these things put together. These are the risk factors, apart from the genetics. So I say modifiable means these are the things which are in your hand, you can always change.
Yes.
But genetically, somebody is prone. You can't control that. It's in the hands of the God.
Yes.
So that you cannot control. There is always a risk among the patients who have this breast cancer among the families, though carry a very high risk for breast cancer compared to the normal woman.
So why 40 to 60 age groups are affected more?
See, there has to be always something. See, if you are hitting like this continuously, so what happens is after 10 or 15 hits, you may slip. So any damage to happen, you have to give some amount of time for damage to happen.
Okay, damage.
So that is mutation. So when there is a hormonal influence on the breast tissue, so we give some time for it to develop. So it takes some time. That's why we say that from 30, late 30s or early 40s to 60. And moreover, it's like most often during the pregnancy, these women are very much protected from breast cancer. That means, say for example, if somebody becomes pregnant at a 25, 26 or 27,
Yes.
that's what it used to happen olden days.
Yes.
So they get a good protection for about 1 year, 1.5 years. 1 year is while they're carrying, there is no influence of the hormone on the breast.
Yes.
And second thing is during the lactation, there is no hormonal influence on the breast. So they get this hormonal free interval of 1.5 to 2 years. If they feed the baby for about 1.5 years, they get something like 2.5 years of hormone free. So they get really protected. That's the reason these days most of them are women encouraged to give at least for 1.5 years to breastfeed the baby so that they get a very good protection.
Okay. Sir, just you told that the ladies right now, when they conceived and when they give birth to a baby, so the chances of breast cancer is
Less in the sense they get good amount of
protection.
because there is no hormonal influence on the breast tissue
Okay.
for about 9 months plus another 1.5 years, whatever, during the breastfeeding time. So there is immense protection for the breast. So that's the reason usually in olden days when they get married around 26, 27, and then they give birth, first baby, second baby, and then
Third.
they go on.
Yes.
So you see this influence only after 7, 8 years after completing their family.
Mhm.
That's how it used to happen. But unfortunately, today our women they have their own way of planning their children, their family, everything. They have more different kinds of priorities, and their priorities have changed, and they are into a troublesome condition because of their change in priorities.
Sir, one question just now came to my mind. If we'll compare married women on unmarried women, right now in our society, few ladies they don't want to get married and they uh, live like that. So in that condition, what is your observation? Whether the unmarried people, those the ladies, those who are not getting married, in that condition, they are coming more. They are more prone to this one.
Absolutely. There is a very high incidence among the women who is not married. We call them as springsters or nuns or whatever.
Okay.
Very high incidence.
So, what is your advice for them? What they should do? Because if
No, in marriage we cannot advise because it's purely their personal decision.
I'm not talking about the marriage, I'm talking about if they don't do marriage, what's your advice for them so that they can prevent?
They should go for early checkup, meaning from the age of 40, they should start having a breast screening by ultrasound, and after they complete 45 years, we suggest them to go for a mammogram. And if the mammo is completely normal, then we give something like once in 2 years or 3 years they can have a mammo. If mammo is suspicious, then we frequently do that, means once in a year we do a mammo and see if there are any new changes coming up. So mammogram is something like it's a small tool, it's an x-ray machine which is basically used for picking up the breast cancer at an early stage.
Okay.
That means we have already discussed about the self breast examination, where you can feel something by hand. Here, you should be able to pick up a breast cancer when even it is not palpable.
Okay.
So that's the advantage of mammogram. But the mammogram has got another a small disadvantage, that is they get exposed to radiation by mammogram. So I suggest they should go for ultrasound at 40, and from 45 onwards they should go for mammogram.
Okay.
That's easy. And if there is a strong family history and anybody who is around 35 or less than 40 wanted to have a best screening method, I would suggest them to go for a MRI of the breast. So MRI of the breast is specifically utilized for the very small group of individuals where there is a breast tissue is very much dense. That means little firmer than a regular one. And second thing is where, because if it is firm, you can't see anything on the mammo X-ray. So it becomes only a white shadow. You can't make out anything. So there has to be some amount of glandular tissue and the fat so that you can see. It should be soft enough.
Okay.
So if it is firm and a little harder than the firm, then they should go for an MRI. Or if there is a strong family history. And we also do these kind of tests for women to diagnose a bit early. That is BRCA testing. That is a genetic testing, whether there's any BRCA, BRCA.
BRCA.
So this testing is basically done in a woman where there is a high risk among the family individuals. So if they have done a BRCA and BRCA is positive in the family, then we suggest to go for a MRI.
What does a breast cancer diagnosis mean for someone's life expectancy?
See, again, once you diagnose,
Yes.
and when we talk about the life expectancy, it is basically based on a stage. So how do we stage? Once there is a patient who is come with a lump to me, we do a biopsy and to confirm whether it's a breast cancer or not.
Okay.
There are different types of breast cancer, which is beyond the discussion. So I would not go into the details, but there are different types. So for that also we do testing that is called immunohistochemistry testing.
Okay.
That is routinely done for all the breast cancer patients. And then once the patient has been diagnosed, they can go for what is called a scanning. If they can afford, they can go for a PET scan for the whole body.
Okay.
Or if the patient can't afford, at least they should go for a thoracic and abdominal scanning to see whether there is any spread to the lungs, bone, or a liver. If there is no spread anywhere in the body, then we consider that as a breast cancer confined to the breast. Or if there is any spread to the armpit, that is a axilla. So basing on that, we group them according to the stages: stage 1, stage 2, stage 3, stage 4.
Stage 4.
So if somebody is coming at a stage 1, they have a pretty high chances of having a complete cure or a complete control of breast cancer. I think close to 80 to 90% of them get cured. And depending upon again what subtype they are. So there are like different types. So the best subtype coming at an early stage, probably they stand something like 80 to 90%.
So stage 1 means
it should be less than 2 centimeters confined to the breast, and there is no spread to the axilla.
Okay, stage 1. In stage 2?
It is 2 to 5 centimeters.
2 to 5. Okay, and spread to the axilla.
Small nodes we call them. And stage 3 is more than 5 centimeters or little number of nodes in the axilla are little bigger. And 4 again divided into involvement of the skin and the pectoral fascia, or if it is spread to the different organs, it is called 4C. It is 40. It is
stage 4. So basically, if it is stage 1, then it can be reversible.
Yeah, always see. The idea of educating the people is so that they can come at an early stage.
Early stage.
So if they come at early stage, there is less treatment. Outcome is good, and the patient can tolerate the treatments. They don't have to spend too much money. So these are the advantages. So if they come at an early advanced stage, you have to spend more. You have to undergo many treatments, and the outcomes are not good as early stage.
So if breast cancer starts few days back only, you notice that it is small lumps. So how many days it would take to stage 2 or stage 3? Is there any something like that?
Usually we call it as it all depends on the doubling time of the cell. So by the time the patient notices 1 centimeter lump, probably that would have started something like 5 to 6 months ago.
Okay.
So that's why there are certain guidelines that once you notice something, immediately you have to take action and start the treatment as early as possible, so that further delay is reduced.
Sir, as we have discussed, patient should go for screening test. So what is the ideal age that patient should go for? Like a lady should go for the
ideally
test?
Most of the societies, whether it's an American society or European, or most of them, they recommend anybody who is above 40 should go for screening.
For Indian?
For Indian, I think we usually have something like above 45, we ask them to go for mammogram, and around 40 we ask them to go for an ultrasound. And if there is any strong history in the family, definitely we send them for an MRI or ultrasound at an early stage.
At early age. Late 30?
Late 30s.
Okay.
They can go for an ultrasound. Ultrasound will not have any harm.
Okay. Sir, what happens during a mammogram? You told on the mammogram.
See, mammogram is a kind of an equipment. It compresses the breast tissue
Okay.
and then it makes an X-ray. So you see different kinds of calcification, or if there is any lump which you can't feel, that also can be seen. So these are very early stage. So you can pick them up and then localize, take it out and send it for a biopsy.
Okay.
If that turns out to be malignancy, immediately you can go for treatment.
So today we came to know so many things about breast cancer screening, general awareness. Sir, I have few other questions also. So, sir, breast cancer can be detected early without any symptoms. Have you ever noticed?
If you do an mammo, you can detect early.
Detected, it is a the child or the girl is 25 or 30.
Usually we don't see. For the last 27 years, I've been practicing, but I have never seen in 20s. Of late, very recently, we have seen one or two patients in our hospital where the affected women were something like close to 21, 20, 23, 22 years lady. So we can't really say today at what age you
Yes.
start picking up these patients, but majority of your patients, they fall into the chunk between 40 to 60. So the risk increases as the woman age increases.
Yes.
And the highest risk is because they are women, they carry the highest risk. As they grow old, there is an increased risk. If there is a family history, there is an increased risk. So like that it goes. If she doesn't have any children, there is an increased risk.
Okay.
So like that it is.
Sir, are there any risk involved while doing the screening tests?
There is not much. So the only thing is you get exposed to radiation. That's the reason we say before 45, I think we should be little careful when you're asking for a mammo. You're justified in doing a mammo for a woman who is more than 45. So,
sir, you are recommending after 45 only you can go for mammo.
Mammo.
Or else ultrasound?
Ultrasound.
Is okay. Sir, when the patient comes to you like late 30s, so already the stage 1 or stage 2 or stage 1, whether it's a condition stage 1 or stage 2, nothing like that.
No, that age doesn't give you anything like if they're coming at 60 years, it is stage 4. If they're coming at 40,
like
so nothing like that. So each individual, when did it start? If they have noticed something like 1 centimeter lump, it would have started something like 5-6 months ago. If the lump is around 2 to 3 centimeters, we presume it to be something would have started at 8 or 9 months or 10 months ago, something like that. It's only a presumption, but we don't know, but because some of these malignancies can grow very fast.
Yes. Sir, if a lump is there, suppose in a patient come, lump is there. How do you confirm that this lump is like a cancer?
So one thing is we look at the age. So generally younger women, they'll have only benign lumps, and this is the notion that older people will have malignant ones, and that is just a general notion. And second thing is that we do an FNAC, that is a fine needle aspiration cytology. So a small syringe will be passed into the lump and they aspirate some amount of the fluid and they see it on the slide whether are there any abnormal cells. So if that FNAC shows something abnormal, then that's an indication that we should go for a biopsy. So we go for a biopsy. But in biopsy, we take about 1 to 2 centimeter cores from different areas of the lump, and then we subject it for examination. And in examination, if we find that there is something very much abnormal, carcinoma changes or something, then we diagnose them as a malignancy.
Sir, if you suppose a patient having breast cancer, so starting stage or while the progression, does he notice any kind of irritation, itching, or any kind of pain?
No, that is a very bad thing that I would say, because it does not cause any symptoms or anything. It doesn't bother the woman. So that is one reason why most of these the women, they come at bit advanced stage, because it doesn't cause pain, it doesn't cause any irritation, it does not cause any kind of symptom, it doesn't give you any warning signal.
Okay.
So it just grow on its own. So